What is AIDS and what causes it? This is a question many people ask. AIDS, or acquired immunodeficiency syndrome, is a severe condition caused by the human immunodeficiency virus, or HIV. This virus attacks and destroys CD4 cells, which are a type of white blood cell crucial for the immune system's proper functioning. As the virus replicates and spreads, it progressively weakens the immune system, eventually leading to AIDS. The term acquired signifies that the condition develops over time. Immunodeficiency refers to the weakened state of the immune system, and syndrome indicates a collection of symptoms and health conditions. HIV is primarily transmitted through specific bodily fluids, including blood, semen, vaginal fluids, and breast milk. Common routes of transmission include unprotected sexual intercourse, sharing contaminated needles or syringes, and from an infected mother to her child during childbirth or breastfeeding. While HIV and AIDS are often used interchangeably, they represent different stages of the same infection. Now that we understand what causes AIDS, let's delve into its symptoms. AIDS manifests through a range of symptoms, many of which are similar to those of other illnesses. This can include a persistent fever, unexplained weight loss, chronic fatigue, and swollen lymph nodes. These indicators often result from the body's struggle to fight off infections and diseases due to the weakened immune system. Over time, as the immune system becomes increasingly compromised, individuals may experience recurrent infections that the body would typically combat with ease. These are known as opportunistic infections, which can include ailments such as pneumonia, tuberculosis, and certain types of cancers. As the immune system's function declines, additional symptoms such as persistent diarrhea, night sweats, and skin rashes may develop. The presence of these symptoms often signifies an advanced stage of the disease. These symptoms can vary widely and may resemble those of other common illnesses, making early detection and diagnosis crucial. Did you know there are different types of HIV? Let's explore this further. The HIV virus, responsible for the onset of AIDS, is not a one-size-fits-all kind of virus. There are several strains, each classified into different types and subtypes. The most common types are HIV-1 and HIV-2. HIV-1 is the predominant strain worldwide, but both types have their unique characteristics. Variations in these strains can impact how the virus is transmitted, how quickly it progresses, and how it responds to treatment. Now, let's turn to life expectancy. The thought of living with AIDS can be daunting, but medical advancements have significantly enhanced the life expectancy of individuals diagnosed with this condition. With early diagnosis and access to proper medical care, many people with AIDS can live long and fulfilling lives. These advancements in HIV/AIDS treatment, specifically the development and widespread use of antiretroviral therapy, have transformed HIV from a fatal disease into a manageable chronic condition. Of course, the prognosis can vary depending on factors such as the individual's overall health, access to healthcare, and adherence to treatment. In conclusion, HIV/AIDS is a complex and diverse virus, but medical advancements have significantly improved life expectancy and quality of life for those living with the condition. While the prognosis can vary, many people with AIDS can live long and fulfilling lives with early diagnosis and proper medical care. While there is currently no cure for HIV/AIDS, there are effective treatments available. This may sound daunting, but remember, managing HIV/AIDS is not just possible, but probable with modern medicine. The cornerstone of HIV/AIDS treatment is antiretroviral therapy, or ART. This treatment doesn't cure HIV, but it does a fantastic job at keeping the virus under control. ART involves taking a combination of HIV medicines every day. These medicines prevent the virus from replicating, which reduces the amount of HIV in the body. With less virus to combat, the immune system gets a chance to recover and strengthen. This keeps HIV in check, preventing it from progressing to AIDS. It's a bit like putting a leash on the virus, keeping it from causing havoc in the body. The effectiveness of ART is truly remarkable. It's not just about managing the condition, it's about living a healthy, normal life. People on ART can work, study, have families, travel, and do all the things they love. But here's the catch. For ART to work, you need to stick to the treatment plan. This means taking the medicines every day, exactly as prescribed. Missing doses can give HIV a chance to multiply again, and the treatment may become less effective. So while the journey with HIV/AIDS may seem challenging, remember that with the right treatment and consistent care, you can lead a healthy and fulfilling life. While a cure for AIDS is yet to be found, effective management of the condition is possible with antiretroviral therapy and adherence to treatment.